New year, same bleak midwinter crisis, pushing the health service to its limits. At this South London hospital, they've almost doubled the number of intensive care beds, and yet it's getting harder to stay ahead of the virus.
We have tried to never get to the point where we are running out of intensive care beds. So we're stretching it as much as we can, but obviously we have concerns that there will come a point at which we will not be able to expand beyond that.
Cases surge and ambulances queue. In the capital, entire hospital floors are being converted to COVID care and staff asked to cancel leave. One doctor told us some colleagues are already facing agonising choices for their patients.
Deciding the outcome of effectively a competition for a ventilator is not what anyone signed up for. And in terms of the emotional trauma to those individuals, it's horrifying. We shouldn't be having to do it, but we are.
1 million people have been vaccinated, but supplies are limited and the infection is racing ahead. So the rules are changing. No longer 2 jabs in 3 weeks. That's now 3 months. So more people will get at least some protection. The UK's chief medical officers have written to NHS staff. We have to act at speed if we are to beat this pandemic, which is running rampant in our communities. And we believe the public will understand and thank us for this decisive action.
The only ways we've come up with to block transmission are major lockdowns and social distancing, or better than that, having people with high levels of neutralizing antibodies on board. So 1 dose will give you that level of antibody, at least for some time, and be better than nothing.
But the vaccines were tested and approved on the basis of double doses.
So I'm angry and I'm upset. And
Dr. Katrina Farrell works with vulnerable patients, so got her first shot last month. Her second, due next week, has now been delayed.
I think it leaves hundreds of thousands, many of whom are vulnerable and have underlying health conditions, with a great deal of uncertainty, and undermines the confidence in the vaccine programme, and that hurts me as somebody who is pro-vaccine.
For all the warnings to stay home, some celebrated last night. The nation could well pay for those pleasures with something far worse than a hangover. COVID has yet to reach its awful peak.